Welcome to you all. I'm getting a lot of chats that there was some issues with the Eventbrite link. So people might be coming late or struggling to log on. And for those of you who dug into Zoom and got the link and figured it out, thank you so much for being here and good afternoon. I'm Wendy with Nourish Colorado. Thank you for joining us for our second in a series of 5 webinars exploring different issues that we explored through our law and policy roadmap, which I will explain here in a couple of minutes. So also, since I am screen sharing, and if anyone needs to chat me directly, it's very hard for me to see chats. So it's best to just literally unmute and call out if you need me, since it's hard for me to toggle back and forth. So welcome. Good afternoon. Thank you for spending this next, almost 90 minutes with us. Thank you, Valentina, for the overview of language justice today. A couple quick things. Want to let you know who is on the line with you here today. Again, my name is Wendy Peters-Muschetti with Nourish Colorado. I get to work with all sorts of facets of our organization here at Nourish, which I love. And one thing I really love doing is I am involved in both our state and our federal policy advocacy work. So the Law and Policy Roadmap, which I will be talking a little bit about today, is a project that I have been able to be involved with since the beginning, about just over a year ago. And that is me. And then there's 2 other people here, Kiana Mickey and Lorena, that I would like to introduce themselves. So they'll be working with us today on this webinar. So Kiana, want to go ahead and say hi?
Yes, thank you. Thanks, Wendy. Hi, everybody. Good afternoon. My name is Kiana Mickey. I am a food systems and equity consultant. I'm based in Harlem, but I work nationally, and I've had a great time working with Wendy and the Nourish Colorado staff on Becca as well, and Tabor on working together to develop the legal roadmap and learning about ways that Nourish can collaborate with partners on our road to transforming policy. So you'll be hearing a little bit more from me a little bit later, but I'm happy to be here.
Thanks. Oh, and please mute, just a reminder, please mute yourself if you're not talking. And thank you, Kiana. And then Lorena, do you want to go ahead and say hi and introduce yourself?
Sure. Hi, everyone. My name is Lorena Garcia. I'm the Executive Director of the Colorado Statewide Parent Coalition. And we are an organization that works very closely with many FFN providers and childcare providers, offering them training and support so they can be high quality providers. And you will hear more from me later on around background and why we're even working on this issue. So thanks so much.
Thank you. Just a reminder to please do mute yourself when you're not speaking. Thanks all. Oops, and I skipped a slide. I skipped so many. Sorry, everyone. I'm making you car sick now. So, and a couple quick reminders too, if you just joined us, just to go back, please chat in your introduction. So if you haven't yet already, please chat in name, pronouns, where you're calling in from, organization if you work with one, and what brought you to the call today. So thanks for letting us know a little bit more how you are. We will have some small group breakouts later, and we'll get to know you a little bit better. Just a couple of housekeeping notes. We are recording this session. Please just chat me or Jesse Hulling in if you have any concerns about that. But we are recording it in both English and Spanish so that we can share it out with partners who couldn't be here today. Please do use the chat feature to communicate with us. And we will be here for the full 90 minutes. And I failed to introduce, there's a few key people that are part of the team that aren't on the call today that I wanted to call out. We are presenting pieces and parts of what we call the Law and Policy Roadmap today. That was a full legal analysis, which I will talk about a little bit more in a minute. So we did work with a couple of actual legal analysts on this. So we were lucky enough to have a 4-month-long legal extern by the name of Becca Gradone, who did a lot of the analysis with us. And she was overseen by Tabor Ward, who is a JD and works a lot in the food system space. So we are presenting a lot of the work that was led by our legal team. And I'm happy to also announce that Becca, who just recently passed the Colorado State Bar, will be joining us as a full-time legal analyst in just a couple of weeks here at Nourish Colorado to help move this kind of research forward for us. So moving on, what are we going to do with the rest of our time together? We're going to do a little bit of time going through group agreements, since we are going to be having some small group discussions together today. I want to do a quick background for those of you who might be new to us as an organization about who we are as Nourish Colorado and what is this law and policy roadmap and why did we do it. Kiana is going to work through a series of slides around how we have been attempting to integrate more both an equity focus and a collaborative process into this law and policy roadmap. And then Lorena and I will be going through the actual sort of overview of the question in front of us today around increasing provider eligibility for CACFP. And then we're going to go into in the last half an hour or so, we'll go into some small group discussions together to capture more of your feedback. So I'm going to pass it over to you, Kiana, for the next slide.
Oh, thank you. Sorry, I couldn't get my tab back to get to the second tab. Here we are. Yes. So thank you. Are you? Oh, yes. Here are the group agreements. I'm looking at the wrong screen. Yeah. So to help us have like a robust and intentional conversation, we just wanted to share a few group agreements. I hope folks are familiar with group agreements. Oftentimes we use these in discussions like this to kind of help foster constructive dialogue and help us hold each other accountable in conversations. So this means for facilitators as well as participants. So some of the agreements that we wanted to share today was listen actively and share intentionally, one mic, one speaker. If folks are able to be present and engaged in the time that we have, I know it's busy days for all, taking space and making space. Oftentimes this shows up if just making sure folks are able to have like a robust conversation. So if you're somebody who talks often, just trying to kind of find ways to make sure you're creating space for other people to share. And if you're somebody who's a little hesitant to share, this is also an opportunity to encourage you to speak up. So this being aware of the space that we are taking, and that for this session, feel free, if we're off mic, to share in our breakouts and times, but also use the chat for any questions or comments that are coming through as we're together. And confidentiality is just around taking the lessons and leaving the details. We'll have probably a lot of folks that are stakeholders in all different spectrums and hold different roles. So just important that we're sharing together, but not, necessarily taking names away. And again, for like the note taking for us when we're in the breakouts, we'll be taking some broad notes just to be able to share in the full group, but we won't be attributing names to those names to the notes. And if folks have any questions, please feel free to use your reaction buttons and raise your hands throughout the session. I'll also, Jesse and I will continue, and Wendy will keep looking at the chat if there's any additional questions. But again, please feel free to use the chat as like a community garden plot as we go on. And especially if you're somebody who prefers to write as opposed to always speaking off mic, that's also a good way to share too. I'm going to pass it back to you.
Great. Thanks, Kiana. And there's one other thing that I didn't mention sort of in the sort of technical housekeeping updates is that when we can, we attempt to have a side-by-side translations on each slide in English and Spanish. When we get into the legal analysis, there is some pretty dense slides, so we couldn't fit it onto one. So just bear with us a little bit. We will be moving from a slide that may be in English then to a slide that's in Spanish, even if the primary speaker is just reading the one slide in English that whole time. So we'll be moving through slides. Please have a little patience with us. We're working through it. There's just a lot of content on these slides. So just a little bit for those of you who may not know or be familiar with our organization. We are a Denver-based but operates statewide nonprofit organization. We do have a mission to strengthen connections between farms and communities so that all Coloradans have equitable access to fresh, nutritious foods. And we have a vision that we envision a world where fresh and local foods enrich the health and vibrancy of all Colorado communities. So a couple other bit about our policy work too. And some of you may be familiar with some of our programs that we operate around the state. Double Up Food Bucks, Local Procurement Colorado, and there are others that you may be familiar with. The focus of this webinar today is really on moving our policy work forward. So one thing I wanted to share with everyone, I know this is a very dense slide. Do not worry about reading all the detail in it. These are just examples. But the point we're trying to share here, and then what is our theory of change? How are we moving our policy work along according to our theory of change? So we do have a 4-pillar theory of change at Nourish, is that in order to achieve that vision where fresh and local foods are contributing and moving forward vibrancy of each and every one of us, we subscribe to this theory that we need to strengthen nutritious food environments, increase consumer engagement with their food system, channel resources to nutritious foods, vibrant farms, and strong communities, and then increase the economic power of households to purchase nutritious foods. And then this table is just an example. And as I'm talking, I'm just going to switch to the Spanish version. This is just an example of how we are trying to identify how we're moving our theory of change forward, what we do in practice. Like, so what you may be more familiar with seeing us do, like through programs or initiatives. What do we actually do in practice to move that theory forward? What is the policy advocacy work that we do to grow and scale that work? But then what ultimately does permanency look like to us? So across all of our work, what we are attempting to do a better job of doing is saying, how do we move from practice through policy to permanency? So the programs and initiatives that you may know us for find a permanent home and just ultimately become the way that the system operates for everyone here in Colorado. So given that, I just wanted to do a light touch on this is how we are trying to operate as an organization, which is a little bit of foundation background about then why a law and policy roadmap. So a couple things too, the law and policy roadmap, it's about 130 pages long. Kudos to you if you even opened it. There is a link in the original invite and registration that you all received. And as well, I see Jesse also chatted in here for us today, just this slide deck. So also if it's a little hard to follow along with this slide, you can pull it up and follow it along yourself as well. So thank you, Jesse, for chatting that in. So this what ultimately became like a 130-page law and policy roadmap. We had a lot of goals with this, is that we wanted to advance that theory of change that I just showed you, is to really understand where there are opportunities for us to meaningfully move forward that theory of change. We wanted to identify what are key areas like policy questions, policy issues that we should really be focusing on to move our theory of change forward. We ultimately wanted legal guidance in this work to more deeply understand, either at the state and or federal level, where there are actual maybe legal barriers that need to change, or where there is silence or lack of clarity in legal language. We wanted to identify and elevate key areas of equity throughout this process, is that very, very often through policy work, both intentionally and unintentionally, work has moved forward through policy that can have significant detriments and it can actually do harm, particularly against populations that we might even purport to try to benefit. So we wanted sort of throughout the process, a lot of checks and balances to say, okay, if we go this way, who's going to be affected? If we go that way, who's going to be affected? We did want to look at both federal and state policy to have a better understanding. If there's a certain change that we want to make, where does that live? Is that a state issue or is that a federal issue? We are also right now in the middle of strategic planning. So it's a great time for us to get feedback on this roadmap, and that's informing our strategic planning. And then we also want to make this research available to anyone. We are a part of many groups, coalitions. We work with a lot of partners around the state, and we would like this to be a resource for our partners, given that a lot of issues that are surfacing here may not be issues that we ourselves lead. We might just support. So we'd like to share what we are finding. And then just really high level today, these are not in order of priority or importance at all. We happen to be today focusing on the last one here, number 7, increasing access to and participation in the child and adult care food program by expanding provider eligibility requirements. That's a lot. We do have these other issues that we've also looked at, and we'll have a series of webinars on as well. Last week, we talked about SNAP integration to increase fruit and vegetable incentives. In September, we'll be talking about these other that will look at more at technology for local food vendors, values-based procurement when public dollars are spent on food, integrating food into the school system, and the establishment or exploration of a Colorado Farmer Equity Office. So other issues that we'll be diving into later. And I did that really fast, so I'm sorry, I'm skipping through this one pretty quickly. So I'm going to now mute myself before we dig into the legal analysis and pass it to you, Kiana.
Great, thank you. Yes, I apologize. I'm having a little delay in my computer. Yes, thank you. So starting with this project, we felt that it was important to just acknowledge some hard truths. You know, that our food system and laws and regulations are built on the profits of exploited land, the atrocities of genocide of indigenous peoples, and slavery of Black folks. So we really can't have a discussion about law and policy without really talking about the inequities that are structural and are still within our laws and our food systems. So we're clear about what we're trying to change. So there continues to remain barriers in changing our food and farm policy, and changing the course of divestment in our communities of color, addressing, land tenure and stewardship, and also good agricultural practices. So in the journey of building this roadmap, we realized the importance of trying to utilize a lens of equity to kind of help inform us on the different ways that it continues to show up in our laws and our practices. And also to kind of start to look at how we can start to spotlight either opportunities for change, for different tactics around advocacy, and new innovative ways to engage with partners. And also to learn from each other within Colorado, and also seeing if there's other things that people have moved forward on, outside in some of these policies. So we want to also acknowledge that policy can be a powerful tool for change, but yes, it's also been used at times for harm and inequity. So we're hoping to continue to find ways to hold ourselves accountable to the intentional and unintentional impacts that policy can have. And within this process, we use this lens. So when you saw the slide that showed racial, economic, and environmental equity, we've used this lens, thank you, to dig a little deeper in the legal and policy research, to continue to find ways to use it to assess impact and determine what Nourish, as a policy-oriented organization, could feasibly do with our current assets, resources, and capacity. So there's a lot of inequity that will persist, and we wanted to be really intentional and clear about what Nourish can do, and also the things that we can do with partners. So that also can look like what it means for Nourish to take on as a lead organization, or are there other strategies that Nourish is actually a partner, and there's ways to take a step back and amplify partners that might be a little bit more engaged in that policy and work? And I think this session is really going to highlight that. We also wanted to find ways to build transparency in the collaboration on the road ahead. So this is just the start of the roadmap, and the continued work with our partners is what we're hoping to bring is this intention, this lens today in this session, but also in the work that we see with our partners beyond this session. And so, yes, with that, I will pass it back to Wendy to go through the...
We're actually going to start. Lorena is going to kick us off with sort of a background of this issue and why we're even here talking about it. So please take it away. Thank you.
Thank you, Lorena.
Right on. Thank you for setting that space for us, Kiana, and grounding us in equity as we have this conversation. I'm going to actually start a little bit with just setting the stage of our childcare system here in Colorado, which I know many of you are aware, and some of you might know a little bit about. Colorado relies on a mixed delivery system, which means that Colorado relies on licensed providers and centers, licensed providers and family childcare homes, and relies mostly on informal license exempt providers that we call FFN, friend, family, and neighbor providers. These are providers that are given legal protection permission to operate in the state of Colorado as licensed exempt providers. Over 50% of Colorado's childcare workforce is licensed exempt providers, and over 50% of Colorado's children are in the regular care of these FFN providers. So knowing this is why CSPC has committed to diligently working with our partners, with our agencies, to figure out a way that we can expand eligibility for CACFP, because ultimately what's important here is that kids, no matter what setting their families choose to put them in, have access to nutritious food. So let's continue. The Child and Adult Care Food Program is, sorry, I'm barely getting to this slide, Wendy. It's a federal program that's funded by the USDA. What this does is it gives providers funding on a reimbursement basis to be able to provide nutritious food in their care settings. This is for adults and children. In Colorado, this is limited to licensed providers. You can advance now. So, as I mentioned earlier, the reason why it's important for us to expand eligibility standards is because a lot of times we'll hear an automatic solution of, well, if there's providers that want access to CACFP, why don't they just get licensed? Multiple reasons why that's an inappropriate response. Number one, licensure isn't actually a reality for many folks who are in the FFN care provider setting. And number two, not everyone who is an FFN or an informal provider need to be licensed. Now let's look at our grandmas and our aunties that are caring for their nieces and nephews and their grandkids. Why do they need to be licensed in order to be able to receive supports to care for the children in their home? They shouldn't have to be licensed if they're already following the law that allows them to operate. We also know that the majority of our Black and brown kiddos are in the care of FFN providers because it's culturally relevant. They speak the language that they speak at home. It's more accessible. Families trust an FFN provider because it's someone that they know, and it's more affordable. Because of the fact that it's more affordable, what that generally means is that families rarely pay for the services of FFN providers, which then means that FFN providers pay for food and materials and any other support systems out of their own pockets. If they're not getting paid, then they're also not making a ton of money, which means that they're also struggling economically. And so this only perpetuates a cycle of poverty within the early childhood system. Colorado recently, with the development of its new Department of Early Childhood, has made it clear that this diverse mixed delivery system that exists is a priority to maintain and support in Colorado, and also that there is concerted efforts to figure out how to expand eligibility, not just for CACFP, but in general of different types of support systems for FFN providers. In this case, as we know, ensuring that children, no matter where they are, have access to high quality food is a public health concern. It's a safety issue. It's about ensuring that kids can grow and be nurtured and that they can have exciting days without their tummies grumbling. You can go ahead. You can advance. So what's the issue here? Well, when we're looking at the USDA regulations, and I want to go to what Wendy mentioned earlier, which I might be stealing some of her thunder, but you probably need to hear it more than once anyway, is that the law that dictates USDA regulations on CACFP is not entirely clear. For some of us, we read it and we think it's entirely clear that basically allows anyone that allows the state to determine who is eligible to give this type of benefit. Basically saying that centers and home providers are automatically eligible under the law. However, there is a statement in there that also gives discretion to the state to determine other approved providers. How that's actually being implemented from state to state to state is different, which causes confusion. We know that CDPHE here in Colorado is committed to ensuring that more children have access to CACFP. And so the goal of this is to figure out how do we move together in a way where we can expand the number of children and adults are cared for or that are being cared for can participate in CACFP. I think, is that still my slide? Okay. So going on to expand on this issue a little bit more. When we talk about licensed or approved providers, the term approved gives us the idea that the state has the authority to say, well, if you're not licensed, then if you fit these qualifications, you could also be considered approved. Many states do limit CACFP only to licensed providers. And right now, the interpretation here in Colorado is that since licensure is available, that only licensed entities can be eligible to CACFP, not taking into consideration that the possibility of the flexibility with the word approved. So who exactly is a legally exempt provider? These are providers that under state statute are allowed to care for children in their home on a regular basis if they are for children under the age of 5, if they're not related, or if there's toddlers 2 under 2. If there's family, if there's a family with 5 kids, a provider can care for those 5 kids at a time because they are all related. This is not an FFN provider. It's not someone that cares for children for more than 24 hours. So it's over a period of less than 24 hours. And it can be somebody that they know, somebody that they're related to, or somebody that they don't know or not related to. If a provider has a child already, that child counts towards the threshold of 4 under 4 or 2 under 2. So there is another element, which is really quick, just in the last slide, which is also, oh, I guess no, it's in this slide. Is this your slide? Great. You go for it, Wendy. I'm going to hand it over to you.
Just jump right in, Lorena. You are, you know this so broadly and deeply, so please jump in anytime. But thank you for the sort of that background and the grounding there, Lorena. I'm going to go in and try and do my best to now share what our legal analysts observed about this program and talk a little bit about, okay, then what are we operating under right now? Like, so what's the current regulatory environment? What's possible? What isn't? So I know this is a lot. So please, everyone, to jump in with like questions, clarifications anytime. And Lorena, please like jump in anytime when I'm talking as well in any of this. So just a little bit about, to keep kind of build on what Lorena was talking about, sort of the situation that we find ourselves in right now. So just again, some more background about how this operates is that the federal government, so the USDA, is establishing CACFP rules, right? Which then allow state agencies to regulate and administer CACFP. So that's sort of the flow of how it works. And then it's up to state agencies to ensure that all participating homes or centers are, again, either licensed or approved, as Lorena talked about. Here in Colorado, it's the new-ish Colorado Department of Early Childhood. So the state agency, I think it goes by CDEC. Please correct me if I'm wrong. I'm going to say CDEC if that's okay. The Department of Early Childhood regulates how childcare centers and daycare homes are licensed. So again, they are not involved with the food side. We'll talk about that, but they're responsible for licensure. So CDEC requires that childcare providers.
Well, let's go ahead and get started out of.
That maybe someone was adding in something else, but that's great. Feel free to unmute since I can't see you if anyone does need to jump in. Again, CDEC requires that childcare providers are licensed unless an exemption applies, which Lorena started talking about. And the CDEC does have the authority at the state level to create a registration or a certification option called a qualified license exempt. Whew. Okay. I know this is a lot. This is sort of the territory we're working in. Just to sort of let you all know, like, what are even some options and potentials here. And I will sit on the Spanish side for just 1 minute and a little bit more on the current regulatory environment. So again, CDEC handles licensure here in Colorado, the Colorado Department of Environment, Public Health and Environment, that's written backwards, sorry. The Colorado Department of Public Health and Environment that regulates the food side, right? So they regulate CACFP eligibility and implementation. And again, licensed providers are eligible to participate in CACFP, any type of provider as long as they're licensed. While legally exempt family child care homes providers are not eligible, they could, as Loretta was saying, they could participate in CACFP if they were to become licensed. And to note, and we have several partners from CDPHE and state agencies on the line here today. Thank you very much for being here. Starting at least, if not before, 2016, and in several consultations since then, CDPHE staff have approached the USDA and attempted to create an alternate approval procedure for FCCHs, right? And this request has been denied by the USDA because the response has been, since licensing standards are available to all providers, since licensing is available, then you have to use it, right? You have to be licensed to be able to then participate in CACFP, even though you do not have to be licensed to be an actual care provider, as Lorena was talking about. So you can provide care. It's just getting over that licensure hump to be able to receive CACFP reimbursements to feed your kids. So a couple of what our legal analyst did is tried to explore, like, how is this, what are their other models? What are their potential channels or avenues for getting this done? So we have a couple of models that we wanted to sort of look to for some answers or potential inspiration, and look to see in how a few other states are addressing this very same issue. So again, there's a lot more to discuss here. And again, this is just the legal analysis. That's why we're having webinars like this and have many, many partner conversations, as we know there's a lot more we need to understand, in addition to just the legal analysis about the environment and the context within which we're working. But some issues that are some models that our legal analysts looked into is CCAP, the Colorado Child Care Assistance Program, which sort of on the face actually operates sort of similar to CACFP, right? And sort of individual is eligible, right? They maybe income qualify for child care assistance program benefits. And then the child care center or home is then reimbursed the fee for caring for that child. So on the face of it, operates sort of similar in terms of an income qualifying individual, and then the home or provider is reimbursed a cost, right? So CCAP has similar goals, but again, different eligibility requirements, which we wanted to explore a little bit why that was. So wondering if the eligibility requirements for CCAP could be used as a model for CACFP. CCAP is administered again by the Department of Early Childhood, so by CDEC in Colorado. And again, the general rule is that any provider has to be licensed to participate in CCAP. However, one difference here is that you can be a qualified exempt provider and participate in CCAP, which you cannot, and participate in CACFP. So again, we wondered a little bit about why that was. Is there something we could model ourselves after, model after here?
Hey, Wendy.
Yeah.
Could I maybe explain a little bit of what qualified exempt means?
Yes, that's this slide.
Oh,
so
no, never mind. Go for it.
Totally. Please keep jumping in. So what is qualified exempt? Great question, Lorena. So again, just to clarify, you can be qualified exempt and still participate in CCAP, right? But this option does not exist for CACFP. So legally exempt, which Lorena has talked about, the legally exempt providers can all become qualified exempt. I know there's a lot of layers here. if they meet certain requirements, right? So qualified exempt, and this is to participate in CCAP, is, as it says here on the slide, a family child care home provider who's not licensed, but provides care for kids from the same family, or an unlicensed provider, but provides care for children who are related to the individual and you're funded by CCAP funds. So there are a few qualified exemptions here that are mostly sort of family defined, family oriented, that again, you do not have to be licensed, but you can participate and receive reimbursement through CCAP. And it says here, care can be provided in any setting. So I know this is a lot, please, and I can't really see chat, but please chat in questions or comments as we go here. Yep. And okay, just interrupt me if that's a question. So again, the reason we looked at this is to see, oh my gosh, are there providers maybe that are not licensed, but participating in CCAP that would also be interested in participating in CACFP? And is that a potential model? So a few other states. So again, our legal analysts did find a few examples from other states that we would like to understand better of where unlicensed care providers were receiving reimbursements from CACFP to feed their kids. So a couple examples, bordering states is New Mexico. They offer licensure, just like we do, to family child care homes and all providers, and allows family child care homes to be what they call registered, right? So it's a different category. They're unlicensed, but they're registered. So whether you're licensed or registered, any of the above can participate and receive reimbursement from CACFP. There are obviously standards and monitoring to this process. In New Mexico, registered caregivers must apply as a registered caregiver and comply with certain security, caregiving, filing, inspection requirements to participate in CACFP as would be expected. Similarly, Arizona does offer licensure, just the way we do, and allows child care homes to be, again, certified. They call it certified, not registered, or alternately approved. And again, licensed, certified, or they have an alternate approval, family child care homes, again, may participate in CACFP. And then we have one.
Wendy,
please.
Wendy, this is Megan. Can I just ask a clarifying question?
Yes, and let's hope I can answer it. You bet.
So for New Mexico and Arizona, when those FSNs go through the registration or certification process, are they going through the same licensing body, or is it through a separate process? So who's designating them as certified or registered?
That is a great question, and I'm going to have to confirm and get back to you, but I do believe it is the same agency. Unless anyone else knows differently on the line. Megan, I will confirm.
Thanks.
I believe so. Thanks. Great question. This is why we want to explore these issues. It's like, oh, piece it apart. And just a note on New Mexico and Arizona as well. We all operate under different regional offices of the USDA Food Nutrition Services. So even though we border New Mexico and Arizona, they are part of the Southwest region. We are part of the Mountain Plains region. So one thing we'd like to explore is, are they somehow getting different guidance from the USDA regional office? Is there different lines of communication? There's a lot of questions I'd have there. I'd like to understand. And one other example, so Louisiana seemed to create their own program on this, right? So it's sort of automatic, right? They have CACFP eligibility requirements in place that automatically allow those home care providers to participate in CACFP, whether they're licensed or not. So again, I will ask the same question about if there's another entity involved with this, Megan, but unlicensed home care providers must sign an agreement with the sponsoring organization. We have home care sponsoring organizations here in the state of Colorado as well. And in Louisiana, those sponsoring organizations work with them to agree to meet certain eligibility and reporting requirements. Louisiana does offer licensure the way we do, or registration to family child care homes, and allows them to be unlicensed. So, and again, this is the same note at the bottom here. Registered homes must apply through the approval process. So there is a process which I will confirm again which agency that is, Megan. That's a great question.
Thanks. And then can I just add one more question?
Yeah.
That in this presentation of Louisiana, if the agreement is between the unlicensed home provider and the CACFP sponsoring organization, what's the process should a sponsoring organization staff member monitor whoever it is comes across childcare non-compliance, whether it be a low threat or a high threat, like imminent danger?
Yep.
So kind of how do they regulate the childcare side? Because childcare and CACFP participation reimbursement kind of piggyback on each other when it comes to loss of licensure.
Great question. So I am writing this down, Megan. Great question. So I will ask, because again, trying to understand if, say, we had a sponsor in Colorado, like Wildwood, or someone who's a home care sponsor that had that agreement with the home care, but then what would be the role of like CDEC? Who would get involved basically here if there were an issue of like non-compliance or risk, right? That's your question?
Yeah.
Great. That's great. Thank you. Have it down. And I love it. Please keep coming with the questions. I have one more slide before we kind of open it up to you all to dig into this a little bit more. And these are recommendations that, again, are just from the legal analysis. So I do want to caveat these in that there's a lot more information that we need to get and know and understand about the current context that we are working in. But from this process, areas that the legal analysts sort of elevated for us that we would like to explore more as opportunities we have here in the state of Colorado of like, do we have a qualified exempt status? As we know, we have a legally exempt and a qualified exempt status. Would it be possible, and is this what we would have to do, is to change the licensing process to allow legally exempt home care providers to choose to become either whatever we would call it, certified or registered or approved. That would have to go through CDEC and their licensing process. Is this an opportunity to perhaps use the qualified exempt model, for example, for certification for CACFP? That would be similar to New Mexico and Arizona. And then another possibility we'd like to potential exploring is, or that would kind of go through licensure and adopt the qualified exempt, again, a category that already exists for providers for CCAP, or do we look at changing CACFP eligibility requirements to allow legally exempt home care providers to then be automatically eligible for participation in the program? So again, more similar to Louisiana model. That would be enacted through CDPHE, through CACFP administrative rules. However, as we know and we've heard today, is that since we offer licensure, the USDA has been very clear with the state of Colorado that since we offer licensure, you have to get licensed. But is there an opportunity here to explore maybe an alternately approved category that we could change through CACFP? And there could be many, many more. And I love that you guys are chatting back and forth in the chat and providing more context and guidance. So that is sort of where we got to in the legal analysis. And what we'd like to do now is open up the floor to more of you in a more dynamic way, and start to talk a little bit more with you all about what you see as potential here, what you know, what you've heard, what you've learned, and go into some small group conversations. So I'm going to pass the mic back to, look at me, bad practice. Before we move to small groups too, Megan, those were great questions. I just want to see, are there any other questions like for the large group that people want to surface right now, or clarifications with everyone before we do small groups? Any other clarifications?
I'll just quickly add, it's actually not a question, but just want to have the whole group hear this. Back in 2021, March through May of 2021, I interviewed 20 FFM providers across Colorado, And the cost of fresh and healthy foods was the top financial challenge that folks identified for me. So really just reiterating the need for this work and this conversation. And also wanted to share, one provider went so far as to tell me that she skips meals so the children in her care eat first. So I can absolutely drop my report into the chat if you need the receipts and want to refer back to them. But just want to reiterate the need for this conversation and this work is real for folks. And we know when providers themselves are struggling to meet their own basic needs, it hinders their ability to provide the responsive and loving and nurturing care that children need to thrive and grow. So we need to take care of our providers so that they can take care of our children.
Katie, there is no universe in which I could have said that better. So I really appreciate you being here and sharing that. And please do chat in the survey results and findings for all of us. And thank you for sharing that. And I see that there's some chat going back and forth here too. Thank you all for using each other as resources. And Naomi, I see you did ask, I know Lorena mentioned about half of our providers are FFN providers in the state. Do you have a number for that, Lorena?
We don't have a number for that because there hasn't been investment in actually tracking any of that information from the state level. But what we do know is that we have an educated guess based on the number of children who are not in licensed centers, are in FFN provider care, and that number is in the dozens of thousands.
Yep. Thank you. And great questions. Thanks, everyone. So more questions always welcome in the chat or in small groups. But for now, Kiana, I'm going to pass it over to you to kind of kick us off to small groups.
Oh, great. Thank you. So yes, we are going to now break into 2 small groups. So we're going to have 2 small breakouts, but we're going to also have 2 breakouts together with those groups. So one will be on reflections, which will start now. The second one is going to be around actions and strategies. So, and we'll have a little bit of time in between to have a full group together and chat. So each breakout will last about 10 minutes, and we'll offer the prompts that we're sharing here. We will have them. Wendy will be a note taker in one group. I'll be a note taker in the other. So we'll have them and can share the prompts one more time with folks. And the breakouts will not be recorded, but we'll do our best to capture notes in the group. So it's understood we probably won't get, we might not get to all the prompts, but we're just hope that these are just seeds to start our discussion together. So without further ado, unless there's questions at this point, we will await Jesse to beam us into our breakouts. Awesome. Oh, good. Everybody's getting beamed back in. I hope your conversations were rich. Our breakout, we had a lot to talk about, and we're in the first and second prompt, but I thought what might be good is to potentially, if you're comfortable, Lorena, just sharing what you were about to share with a small group, with the full group, if that's okay.
Sure. The question was around learning more about why FFN providers don't want to be licensed. And I just mentioned, it's an important question, but it's also not the solution. And I was going to go into saying one of the reasons why families choose FFN providers is because of the continuity of care. FFN providers care for the children from kindergarten, first, second, third, and beyond. And if you're licensed, you're limited to an age group. So whether it's a family child care home or if it's in a center, you don't get to rely on that continuity of care with your provider. And so that's a big reason why many don't want to go that route, because they're like, well, then when they turn 3, I can't care for them anymore. Or when they turn 5, they go somewhere else.
Hi, everyone. I'm Naomi Stenton. I work at the CDPHE Child and Adult Care Food Program. And just a little more context about why I was asking about barriers, just learning more about barriers. Lorena mentioned that the the legislature invested more money last year into FFN, and it sounds like there's a unit within the Department of Early Childhood. And so I was recommending it'd be nice to invite them to the table and hear more about the data. How many and I know somebody put in a chat, we don't have that data, but I know when I looked into it in 2020, CDHS at the time that administered childcare license had that data. It might not be totally accurate for anyone that doesn't report, but I think we're missing some people at the table. Childcare licensing should be here. I think FFN providers should be here. I also think we should invite our family childcare home sponsoring organization who sponsor family childcare home and see what desire is out there. And so I just wanted to give a little more context. It's not just, why don't they want to be licensed? There's a lot of data I think we need to inform the group and determine how to proceed forward.
Thank you for both sharing, Lorena and Naomi. Now that we're together as a full group and we have a few minutes with each other, I was curious if other folks wanted to share either from what you talked about in your breakout or what's is being discussed so far. Okay. And one thing I also wanted to add, if there was a question around councils or if there's more information around the advisory council, it came up, it might have been directed to you, Lorena, but I wanted to open it up to the full group if folks are familiar with the advisory council. And I might be getting the wrong acronym for it. I apologize. I'm curious, Wendy, what potentially came up in your breakdown?
Some similar comments to Naomi was talking about really understanding from the sponsor's perspective, right? The home care sponsors, they need to be here and see sort of how they where and how they see options or not was reiterated in our group as well. And also there were some comments about really needing to understand from the beginning, which I think Lorena just talked about though, is there an overall lack of access to affordable, culturally relevant, high quality care? Like what sort of like root cause issues here around just access to what kind of care where in the first place? Talk about how licensing does require some really critical high integrity items that we wouldn't want to lose. And then, Britt shared from the farm to child roadmap perspective, the farm to child roadmap that if you all don't know about it, we can follow up with resources and share the farm to child roadmap as a follow-up to this. But that process very intentionally engaged FFN providers all across the state and sort of universally heard, consistent story that FFNs feel unsupported, that it's not a fair and equal system. They're struggling to provide or stay afloat and provide healthy food in the same way that other centers are. And so really need to sort of elevate those voices and concerns as well. So a lot of similar things. Thanks.
Great. Oh, yes. And before Katie jumped off, we also had talked about just, again, like touching on the stories that are coming from the ground. And in her report, and I'm not sure if other folks have other stories from providers as well, but just if there's not support on reducing the costs for the providers, they're going to continue to take this money out of their pockets, and we're all facing higher food costs. So that just means it's probably even harder for folks now than it was before. But I'm sure there's going to be continued stories around what people are facing on the first on the front lines. Thank you, Andrea. Awesome. And And this is very common. Oh, so Lorraine had said in the chat that they trained at her organization 200 FFN providers each year, and this is a very common occurrence. Great. Awesome. Any other thoughts before we jump into discussing actions and strategies? Yes, Naomi?
I wonder if it would be helpful to share with the group the efforts that the state has made around outreach with all child nutrition programs. Would that be helpful, or is that is there not enough time to really share about that? Okay.
No, I think we have a few minutes for sure. Thank you.
So, you know, obviously, the CACFP team has strategic priorities, and one of them is outreach and increasing meals and snacks served in Colorado. And we still have work to do, but we have come a long way over the last few years. The pandemic and the waivers that were made available from USDA have allowed more flexibility and allowed us to reach more children and adults in the program. We partner with the Blueprint to End Hunger Colorado. We partner with the Preschool Development Grant Quality Nutrition Work Group, which involves partners from Tri-County Health Department, CDEC, CDHS, CDPHE, CDE, lots of state agencies, as well as sponsoring organizations and other nutrition advocates. And the Preschool Development Grant has created lots of new materials, brochures, and we've done intentional outreach, which includes FFN. It included any licensed provider that does not currently participate in a CACFP, and we do that on a routine basis, typically twice a year, but really more than that because our existing family child care home sponsors get a list of licensed providers from CDEC on a monthly basis and reach out to them and talk to them one-on-one. So there's lots of avenues for outreach in the child and adult care food program. And I'm happy to share those resources with you. And then I can't fully speak to this, but I know through some of the American Rescue Act and some of the other funding made available during the pandemic, the cost of licensing would be covered through that funding. So any FFN provider had that available to them. I'm not saying they had to do it, but it was made available if the cost of becoming licensed was a barrier. So we took the opportunity to spread that word and include CACFP brochures, cost benefit tool. And I'm happy to share those in the chat if it would be beneficial to this group. But I could go on and on, but I just wanted to give you a few minute review of what we've been working hard on for the last 4.
So we are almost at time. Thank you for everybody who's been here. I thought maybe if there are any burning thoughts or things that we want to share from the small group, maybe taking 1 or 2 things, again, feel free to also add in the chat. In this part of the full breakout, thinking about actions and strategies. And if not, I will pass it to Wendy, but just wanted to open it up to folks to see if there's anything they wanted to share from our most recent breakout. Okay. We definitely have the notes, and we'll definitely be sharing that with folks. I wanted to say thank you for everybody who has shared. Thanks for bringing your thoughts. I'm going to pass the mic to Wendy to talk us through next steps.
Thanks, Kiana. And thank you all for being here. And those of you who were able to stay for the full 90 minutes, really appreciate it. Great breakouts. I will share one quick thing from my group. Thank you, Megan, for bringing this up is, hey, there's a lot here to figure out. And while we're figuring this out, like what can we do to actually address the current food gap, right? What can we do? What can we connect FFNs to in the meantime that are really struggling and really want to provide healthy food to their kids? So let's figure this out and let's address some immediate issues. So thank you for pulling that up. And in terms of next steps, We will be sharing out this recording in English and Spanish and the slide deck, as well as several other resources that many of you shared throughout the call. We'll sort of do a big one package follow up with you. Thank you so much. All of this is going to the team we are working with at Nourish that's doing our strategic planning. So all of the roadmap, these webinar, we're sharing all of this for those who are helping us do our strategic planning. Not so much this one, but across the roadmap series, we're in the middle of working on our Farm Bill platform, for example, at Nourish Colorado. So all of this stuff we are really listening to and engaging around and using in our policy platforms. And we will have 3 more conversations. So please, they were all in the same invitation. Save the date, register now if you haven't. We'll be talking about opportunities to include values-based procurement requirements in public dollars spent on food, Thursday, September 8th. We'll be talking about providing local food vendors with basically affordable modern technology. So this is around like farmers markets, direct market farmers, being able to say like accept SNAP online or have free EBT equipment so they can accept SNAP at no cost, those kind of issues. That will be Wednesday, September 21st. And then we'll land on what maybe my personal favorite I'm most excited about, integrating food into the school system on September 27th and really looking at ways, how do we kind of sort of put school lunch on the same playing field as, say, math, right? Is that food and lunch and meals are an integral part of the school day and we think should be part of the school curriculum. So what are some opportunities for doing that? So that's the rest of our those are the rest of our plans. Please join us in September if you can. We're really excited for more conversations. Thank you all for hanging here so long. I see your chat, but funny. So thank you all so much. We'll follow up. And please, hopefully you know how to reach us from the invites. Reach out anytime with more thoughts and questions. And we're going to keep this going. Thank you all. Have a great afternoon. Almost